I think the main learnings in the sense of predictive modeling for NHS is that these models are able to describe a certain subpopulation and to give possibilities to any institution, to any provider in the NHS to focus on right measurements, on right processes. We have got such a long history of predictive modeling in Germany in the sense of the UK system. But what we learned in the last, let's say, 3 or 4 years, is that we are able to sharpen healthcare programs by predictive modeling or by risk stratification, risk modeling. I think for the application of predictive modeling, it is very important to focus on the main contents of a healthcare program. So at the beginning, there must be a phase of defining what this healthcare program should achieve at the end, and then to try identifying right patients, identifying the right measures in providers' practices or in hospitals. And everybody who is working with predictive models must have in mind that if only one single variable is changing, it can change the whole model you're using. So look very carefully at changes in your population, in the whole population of NHS, for example, and then decide when to develop, when to change your model. These are one of the major things I would say taking care of while applying predictive models. Oh, I think there's a big field for developing predictive modeling. We will just make the first steps in the last 3 or 4 years by identifying eligible patients for healthcare programs, by identifying remuneration system levels, and I think there can be done a lot more. Actually, we are working on describing people who will profit from healthcare programs, but there are also possibilities to detect fraud and misuse, or to describe if there's professional malpractice, for example. These are future items we will work on. From the technical point of view, we will use external data supplementary to our data we have at the moment. So in UK systems, you use, for example, data air pollution or commuters between cities, and these data are not used so far in Germany. This is a third point we will work on. And maybe the fourth point is to look in detailed forms to regional variations.